High temperature for no reason in children. A high temperature is not a disease in itself, but rather a sign that the body is fighting the disease, as the fever stimulates the immune system, and it sends white blood cells to fight the cause of the infection. But what about the high temperature for no reason in children? A common complaint among children is a high temperature of more than 38.3 degrees Celsius for a period of 10 to 21 days or more, frequently with no apparent reason after the initial examination of the child, and this is known as a case of unexplained high fever. In fact, this problem is one of the most challenging to diagnose. Symptoms of hyperthermia for no reason in children. In addition to a temperature rise above 38 degrees Celsius, other symptoms of unexplained high fever include the following. 1. The child is not as active as usual or is not talkative. 2. The child is not hungry, or is increasingly thirsty. 3. The child sweats or has chills. 4. The child feels disturbed and behaves in an unusual way. 5. Feeling of warmth or hotness of the child. The child may also have the following symptoms, which may help doctors determine the main reason behind the high temperature. 1. Sinus congestion. 2. Cough. 3. Tired. 4. Sore throat. 5. Weakness. 6. Itching. The causes of hyperthermia can be classified as one of the following. Infection with an infectious disease, such as tuberculosis, Lyme disease, or cat scratch fever. Having a malignant tumor, such as leukemia, pancreatic cancer, lymphoma, or other types of cancer. Having an autoimmune disease, such as lupus or inflammatory bowel disease. Diagnosis of unexplained hyperthermia in children. If the fever persists for more than 3 weeks, long enough to be classified as idiopathic, the doctor may perform the following tests to determine the cause of the fever. Physical examination and asking about the child's medical and family history. Blood test and physical examination to check for certain conditions, such as autoimmune diseases. Culture of blood, urine, or sputum to check for bacterial, fungal, or viral infections. Imaging tests of the heart or lungs. Treatment of unexplained hyperthermia in children. The child must be treated if his temperature reaches 39 degrees Celsius, and these are the most important suggested ways to reduce the temperature. Giving the child medicines to lower the temperature, such as ibuprofen or acetaminophen, and it is necessary to note to avoid giving the child aspirin, because it is associated with a rare syndrome in children known as Reye's syndrome. Ensure that the child wears light clothes, as excess clothes trap heat in the body. Encourage the child to drink plenty of fluids to avoid dehydration. Avoid using alcohol to lower a child's temperature. Give the child a lukewarm bath, and avoid using cold water. When should a child receive immediate medical attention? The child should receive immediate medical attention if the temperature rises above 40.6 or the following symptoms appear. Baby crying or being upset. Neck stiffness, shortness of breath, the appearance of a rash, inability to wake up, inability to swallow. In the event that the child is 3 months old or younger, and his temperature rises to 38 degrees Celsius, he must receive immediate medical attention.